Welcome, Dr. Amy, for the Early Intervention Summit. Welcome to the summit. Thank you for agreeing to speak at the last minute request. And thanks, Mark, for connecting you to me.
Yeah.
Summit.
Yeah.
Thank you. And I'm going to read out Dr. Amy's your profile so that everybody knows who you are and where you're coming from. So Dr. Amy Carlson graduated with her Bachelor's of Science and Master's of Science degrees in Communication Disorders from Marshall University. She worked for 12 years as a speech and language pathologist in clinical, home health, and educational settings, serving patients of all ages. She graduated with her doctoral degree in curriculum and instruction with an emphasis in teaching and higher education leadership from Marshall University. She works in collaboration with West Virginia Autism Center and West Virginia Department of Education, Office of Special Education as an early childhood positive behavioral interventions and support coordinator for the state of West Virginia. Welcome, Dr. Amy, once again, and over to you.
Thank you. Thanks for having me. Welcome, everyone. Welcome to the Kids Sense Conference. I'm going to take a second here and share my screen. I'm going to pull up my PowerPoint. So if you'll hang with me here just a second. All right. All right. So I appreciate the opportunity to speak with you today, and I hope that this is a nice kickoff for the conference. And since we're talking about early intervention, which is near and dear to my heart, I am someone who I've worked with all ages and all populations across the lifespan, but my favorite have always been that birth to age 6, 7. I like little people, as I say. So this is very exciting for me, so I appreciate you having me today. And because we are talking about that population, we all know that one common thing among all children, whether we're talking about kids who are developing at a typical or neurotypical rate, or children who are maybe have other diagnosis or other issues, or are maybe a little bit delayed in some of their development, that behavior and challenging behavior is something that is universal. So I want to talk to you today about that. I love quotes. Quotes are something that get me thinking about topics and ideas, and they push me to explore more. And this is one that I saw a few years ago. And here in West Virginia, in the United States, it hit me in the heart because it made me think about one thing we're facing here in our area where I live and where I work is an opioid epidemic. And the collateral damage from that is widespread. But the one thing that is the most heartbreaking to me is what it's doing to our children. Children who are being born into it and who are being raised in environments of toxic stress and trauma, and what are the results of that. And this quote by James Baldwin says that these are all our children. We will profit by or pay for whatever they become. And I think that if you work in the field of early intervention, no matter what your background is, no matter what your discipline is, you would agree that that is true, and there is great weight in that. And because of that, we know that we must address issues head on. And the earlier we do it, and that's the beauty of early intervention, we get in there at the most opportune time, that we will see better results down the road. And the sooner we treat issues, including behavior, the sooner we see results, and prognosis is always increased by early intervention. So in thinking of that quote, I want to use that quote to think about this lens of what we're going to talk about for our rest of our time here this morning. And persisting challenging behaviors, meaning not just typical, every kid has times of tantrum or meltdown, but we're talking about when kids really, whether at home or at school or at daycare, wherever they are really struggling with behaviors that are getting in the way of their learning, the behaviors that are getting in the way of their education, of their ability to have relationships with peers, with adults. And we have to ask ourselves, what can we do and how do we do it? So often we think about, we want to focus on what the child is doing. And that's really the topic I'm going to stick to for the rest of our time here today. It's not about what the child is doing is not the jumping off point. It's not the starting point. It's what can we do and how do we do it? Now, for me, everything I do in my job, as you mentioned, I work as the Early Childhood Positive Behavior Interventions and Support Coordinator for the state of West Virginia at Marshall University. Everything myself and my colleagues do is through the lens of the pyramid model. Now, the pyramid model is a multi-tiered system of support. That's a whole other intensive training, multiple trainings for other days. I don't want to spend too much time, but I wanted to give you the information. Number one, to know if you're familiar with it, so you can see where we're going and where my thinking and where my beliefs are for the rest of this presentation. But also, if you're not familiar with it, I wanted to give you this so that you could look it up and get more information. And I'll be sharing my email and a website and also our Facebook page for you if you want more information on it. I'm happy to talk to you about it, answer any questions, or give you more resources as we go. But the pyramid model, the whole goal of the pyramid model is to do one thing. It's to promote social and emotional development. And we know social and emotional development is the umbrella in which behavioral issues fall under. So good, strong social emotional skills in children lead to less challenging behavior. So how do we set that up? It's through the pyramid model. So I'm going to ask you a question. Now, if we were doing this live and we were in a big room, which is not the way the world is set up right now, but what I would do is ask you as an audience to say, let's look at behavior and let's start looking at what do kids do when they get upset? And typically when I ask this question of my audiences, I'll usually get very quick responses. So I'll ask you to think about this and maybe take a time and jot some things down. What do children do, children in general, or maybe a child you're thinking of specifically? What do they do when they get upset? We'll sit and think for a second. And typically the answers I'll get are the same no matter when I give the presentation or no matter where I give the presentation. People say things, kids scream, they cry, they hit, they kick, they throw themselves on the floor. Sometimes I get more aggressive things. They bite, they punch, they throw things, they cuss, they spit, they whine. So we see a gamut, don't we? But kids act out. That's what children do. We don't have to teach them these things. They're born with the ability from the beginning. They learn in the beginning of from birth. You know, what do we need to do to get our needs met? We cry. So as kids develop, the brain is trying to catch up with all of these big feelings. They act out in ways that I just mentioned. And maybe obviously there are more than the ones I just mentioned, but I just hit the big ones. So think about that. That's what kids do when they get upset. We know that, right? And we know it's challenging for us as an adult because those things interfere with what we're trying to get done, what we're trying to do with the child, or what we're trying to do to help the child. So the second question and the second part of that is, I'll ask you to look at behaviors still, but what do adults do when they get upset? Think about that for a second. And for the most part, what I find in audiences, they will get quiet for a second and then immediately someone will say the same thing. And it's true, isn't it? Now, I don't want to be I don't want to be confessing any of big major flaws or faux pas or sins here, but you know, I'm guilty of all of those things. I don't throw things so much, but boy, I can get angry. Sometimes when I'm so mad, I can cry. Sometimes I'll yell. Let's be honest, sometimes I'll curse. Nothing like driving down the highway and having someone cut you off and give a little road rage of something you're not proud of, but you do it. So if what we do as adults behaviorally is the same as kids, what's our excuse? Kids are kids. Kids are typically developing in a rate that is not allowing them always to deal with these emotions. But as adults, we've been trained, and hopefully over time we've learned to manage them. But we still have moments, don't we? And even when we're pushed to the limit, especially in times when we have more precipitating factors, things like if we're more stressed out, we have a lot going on at home or at work that we're worried about, then what's our excuse? We act out impulsively the same way kids do. So if we know that behaviorally, we all act the same across the lifespan, then we know that this is more than just behavior. Behavior is the representation or the symbol of something much bigger than just the moment that the child is in, what we're seeing. And this is a great, another quote that I actually saw in a training that I attended just a few months ago. And this is from a psychologist, Ashley Warner. And she says that when we meet the need, meaning the behavioral need, rather than focus on just the behavior itself, then we begin to deal with the cause and not the symptom. So think about that, and what does that really mean? Well, it's more than just behavior, isn't it? Because beneath every behavior, think about your own feelings and the question I asked just a minute ago about what you do when you're upset. But beneath every behavior is a feeling. And even deeper than that, beneath every feeling is a need. And the need is not being met. Therefore, we act out in the behavior that you're witnessing or you're experiencing. So think about that in terms of children. If we meet the need rather than focus on the behavior itself, then we'll actually work on changing the behavior by building up skills instead of just focusing on that moment, what the behavior is. This is an analogy that I use a lot to sort of take the behavior and put it in terms of things maybe we're more familiar with. So if we think about ourselves, and let's say that I am someone who had an injury and I broke my ankle and I went to the doctor. The doctor does an x-ray. He or she comes back and says, oh, yes, you broke your ankle. It's pretty bad. So I'm going to put your ankle in this cast, and I'm going to give you some crutches. And that way you can walk. Okay? That's meeting that need in the moment, and you leave. And that's where it stops. Well, what's going to happen? Well, I'm going to leave that office, and I'm going to have the ability to walk out of there with help, with support, with crutches, with a cast. And the healing will start. But long term, it's not really changing the result of what I did. Because if I just leave it as the symptom, by treating the symptom, the fact that I can't walk, then I'm not treating the cause. Meaning, my ankle probably is not going to heal right. I'm not going to have any follow-up, any doctor to check to see, is everything going okay? How is your progress? Certainly would need physical therapy, something after the cast comes off, so that I'm not on crutches the rest of my life. So by treating the cause, putting things in place to monitor progress, putting things in place to treat what it is that we're seeing, to treat the need and the feeling rather than just the behavior itself. So that's a huge change in a lot of times what we're thinking about when it comes to education, and actually even in parenting sometimes. So for instance, if we look at behavior more than just what we're seeing and look at why it's happening, the cause of it, the need of it, and we focus on changing that cause and that need, and 9 times out of 10, I will tell you, the thing we have to change first is our own behavior. So I'm going to ask you to do something that sounds simple in a question form, but I promise you in practice, as you probably know, a lot of you already, this is a major game changer and really a major challenge for a lot of us, myself included as a parent and as an educator and as a speech pathologist. I'm going to ask you to shift your focus from what a child is doing and focus on the behavior of the adult. Focus on the behavior of what you're doing. Now you might say, well, what is that about? Well, that's because we know that the key to managing difficult behaviors, especially in young children, is to shift our thinking about what is going on in that child's behavior and really manage our own behavior and our response to that behavior. Now that quote is from someone who I admire greatly, Dr. Rosemarie Allen. She gave that quote in a keynote actually that I attended at a conference back in 2017. And this quote came from that, and I was blown away because it really gets at the heart of what I'm trying to convey in the pyramid model, but also in what we're trying to do much on a larger scale, culturally here in our state, is really changing the culture and climate of the way schools are set up, the way classrooms are set up, and hopefully the way homes are being set up with parenting, and looking instead inward to know that most of the time, 99% of the time, that if we change what we're doing in our own behavior and our response to the behavior, we'll see a change in the child's behavior that we're working with. So what does that really mean? Well, again, this is just the tip of a much bigger iceberg, but it's really changing our belief system in two areas. It's getting this feeling and this belief that discipline and punishment are somehow one and the same. And I'm here to tell you today that they're not. They are not synonymous. Discipline so often has been thought of as, how do you change a behavior? And usually our first response as a parent or as an educator is to punish for bad behavior. For challenging behavior, we'll punish you, go to timeout. Punish you for, we'll take something away. You don't get to do this, I'll take it away. You've lost the privilege to get to do an activity or a toy, or you've lost the ability to have, back in the day when I was in school, we took away your playtime, recess time. And it is just what we've been brought up to do, because for most of us, it's how we were raised. So what I'm going to say to you today is punishment, even though maybe it has a place in some aspects for behavioral learning, it's not going to change behavior. And it's definitely not going to change challenging behavior. So I'm going to challenge you to think about focusing on your own behavior and thinking about the response. And that response is to know this, that discipline and punishment are two separate things. In fact, I love this definition of discipline by L.R. Nost, wonderful author. If you want to read some of her information, I can send you some links, or a simple Google search would lead you down to where some books that she's written that are just wonderful for parents especially. But here is a great quote that what discipline is. Discipline is helping a child solve a problem. Punishment is making a child suffer for having a problem. If we want to raise problem solvers, and we all do, don't we? Then we have to focus on solutions and not retribution. Retribution, that's the punishment piece. If we just continue to punish, and think about in your own life, if punishment worked on the first stab, we wouldn't have to continue to do it over and over. And even when we do it over and over and over with children, we don't see a change, do we? If you think about that, we really don't. Especially for kids who have ongoing challenging behavior. Oh, sure, maybe for the kid who, 90% of the time is doing everything that you ask them to do and is really good socially, emotionally, has great relationships with teachers and with parents and with peers, and they act out because that's what kids do. It's what adults do. Once. Scare them into it, punish them out of something one time, and they change it. But that's not who we're focused on, is it? We're focused on the kids who 80% of the time are not able to function, who are not able to cope, who are not able to deal with what is going on, and they act out as a result of it. And discipline is actually, and it's embedded here, solving a problem. Solving a problem implies what? Teaching. Teaching the skills. And that's why if we focus on discipline and get our eyes out of focused on our first initial response, changing our behavior, changing our response, teaching ourselves not to go to punishment right away, then we can actually do some major changes and make major impact with kids. And that falls under something called self-awareness and understanding that behavior falls in an integrated experience. Meaning this, self-awareness, it's just your awareness of your own behavior in response to the behavior of others. So for instance, if I know my first reaction is to punish, and that's where I want to go down the road and change, then I have to be aware of what is my first response. And where does that come from? What is my thinking? What is my belief system? Second part of that we have to focus on and understand as an adult is that rational detachment has to take place. And that is taking emotion out of the equation. Meaning we can't get wrapped up in personal feelings in response to what something a child is doing. So for instance, if I am getting angry at a 4-year-old because they're acting out, I have to remember I'm 40 years old. that child is for. That child is not personally picking on me or making me respond because they have some vendetta against me. It's ridiculous, but we do think about those things, don't we? We take it personally. We get emotions. We get angry. We get frustrated. We get things that are natural. Of course, we all do it. But if we remember to rationally detach, remember it has nothing to do with us. It's what's going on with that child, taking our own emotion out of it. It'll also help us in the future and how we encounter. I'm sorry, I'm having some sun come in here all of a sudden. I'm going to close my blinds. There we go. Taking the emotion out of it really takes the equation, and it lowers the stakes. And if we take the emotion out of it, we also change in what children we're responding to and why. Because what we'll find is if our relationship gets tied up in kids who experience and who are displaying challenging behavior over and over, sometimes as adults, we're more prone to pick on those children, to pick out their behavior, to be more sensitive to what's going on. And we don't do it purposely. It's just a natural consequence sometimes because of our own experiences shape who we are. And that's natural. That's what adults do too. So we have to be aware of it. We have to understand that behavior, rationally detached from it, it's an integrated experience, meaning what I do affects that child, just like what that child does affects me. That is from adult to adults, from children to children, from children to adults. Behavior is an integrated experience. You know, if we think about it in terms of a graphic, it goes in a circle. What I do affects you, what you do affects me, and it's ongoing. It never stops. And now, this is the phrase that I use, and I'm not sure if this translates, but I'll explain it here. I say to people, ultimately, you have to remember, don't pick up the rope. So here we have a game called Tug of War, where essentially two teams of people will get on both sides of a long piece of rope, and we pull. You may play it there too, obviously. I'm not sure. So if you do, forgive me for explaining this. But tug of war, you pull until one team crosses a line. So whoever is the stronger, whoever pulls the hardest, wins. And so often what we do is when we get into battles with children, and that's what we're doing, we're choosing to pick a battle because we pick up that rope. And the second we tug back in our response to our behavior, meaning if the child presents to us and says, no, I don't want to do that, and we meet them with sort of explosive behavior of ourselves and say, yes, you are going to do it, and you're going to do it because I told you to do it. Guilty, been there, done that, said those exact words with my own son. Immediately, his response is to up the ante and tug back. And it's all of a sudden, I'm in this integrated experience. My behavior affects him and his behavior affects me. And we're in this battle. And immediately, the second I responded in the way I did, I've lost. No matter what the end result is, if I get what I want in that moment, I've not done anything to change his response or his behavior in the future. And in fact, I've just probably prolonged that I'm going to have another experience like that again. So what I have to tell people, and I tell myself all the time, is don't pick up the rope. Don't engage and get into power struggles with 3, 4, 2-year-olds. Don't respond in a way that you as an adult know better and can do better when a child at that age is just doing what they can with what they have, especially kids who are experiencing issues with social emotional development. So don't pick up that rope. Don't engage. Remember, you have the power and you're aware of what you do in your response to the behavior. You can detach. You can take the emotion out of it, and remember, it's not about you. It has nothing to do with you. It could be any adult in that situation. That's what the child's going to do because that's what they do, and that's the skills that they have in that moment to deal with it. Why are you responding the way you are to that child? And if you don't pick up the rope, then you don't engage in that. Here's just another illustration. I used to print this out actually and keep a copy in my office when I worked in the school system here in West Virginia, just to remember kids who were really, really struggling. And this is kids, you know, any child, really at any age, but we're talking about early intervention here today. So young children, if we don't pick up the rope and get into this tug of war battle, and instead we take the moment, we get them regulated, we respond appropriately in a calm, cool, regulated manner ourselves, then we can go and look at what are our expectations. Are we teaching expectations? Are we teaching rules? And are we basically teaching behaviors that we want to see? And that's the key. The word I just said 3 times there, teaching, teaching, teaching. Instead of just responding with punishment, discipline, solving a problem, teaching is discipline. We have to model, we have to practice, we have to reteach, and boy, oh boy, do we have to acknowledge, even when we see steps toward, maybe it's not exactly what we want to see in our classrooms, but when we see kids making progress, and progress for some kids comes in inches rather than miles, is what I say. Praise those inches. Those are some kids' centimeters, let's be honest. So praise and acknowledge specifically. When you see the child making an effort, it might be a centimeter, it might be an inch. We have to acknowledge it and be sensitive and be sincere in how we praise and acknowledge what it is we want. Here's another L.R. Noss quote that sort of sums up this thinking, because this is the truth of it. When little people are overwhelmed by big emotions, and remember, all behavior comes down to a feeling, which then comes to a need. So it is emotional response, isn't it? It's our job to share our calm, not to join their chaos. And when we respond in big emotional ways back to children, we're only adding to the chaos. Love that quote by L.R. Noss. So I'm going to finish with that. That's just a little appetizer for your conference here. And I hope that it gives you some thinking about our own role in behavior management. And really, it's the biggest role in behavior management, no matter what child you're working with. Here's my email address. If you'd like more information about anything I talked about today, I'd be happy to share it with you, some resources, or maybe just questions that you're having about some thinking or something that I said. I'm with the West Virginia Autism Training Center at Marshall University, and my project, you'll see our logo here, is West Virginia ECPBIS, Early Childhood Positive Behavioral Interventions and Supports. We have a Facebook page. I'd encourage you to like it, at West Virginia, at WVECPBIS, and we have a wonderful website. It's www.wvecpbis.org, and it has great information about not just what we're doing here in our project and our program, but also things that can help, and we share that universally can be useful to parents and educators across the world. So I appreciate your time. I hope you have a great conference, and I'm going to escape out of this now, stop sharing my screen, and we're going to do some question and answer, I believe.
Yes, thank you so much. That was wonderful. Thank you so much.
Thank you. I'm going to close these blinds now too. I apologize. The sun is rising as I speak here, and I'm in a glare.
Okay. So in India we have a slightly it's a wonderful way of looking at behavior, shifting the focus from the child to the parent, from just the behavior to the need why the behavior is happening. That's such a wonderful insight, and it's very difficult for parents to make the switch. Been there, done that.
It is. As I said, it's such a simple concept when you see it on paper. Yes. But to do it, to practice it, I'm going to move here. There we go. But to practice it is that's another challenge. Yes. But it's critical.
Yeah, it needs a lot of understanding and patience, and every morning I used to wake up when my kids were younger and pray that God give me more patience today. I need more patience today. My kids are 20 and 21 now, and I still pray that. It's not over. I don't know. It's not be over.
It probably will never be over. I have a 2-year-old. He's almost 3. Mm-hmm. And I'll tell myself sometimes, like, well, when he gets older, and I'm like, no. Older kids, different problems. Younger kids, different problems. It's just, it's what we take on, right? And educators, parents, we all know that. But yeah, I pray for patience and fail daily as well.
Yeah. And also did a lot of parenting mistakes and learned that those are not going to work. And then, I think every parent has to go through this journey of making mistakes and learning from the mistakes and growing into a better parent, as you're parenting. And so it's a lot harder than just following somebody's advice for parents. And in India we have a different level of battle that we need to fight because of the hierarchical system of families. It's such a hierarchical families that we are in, that we have a very clear head of the family. I mean, not probably in the cities. It's in the cities, we're trying to be as democratic as possible in our households, and we try to, try our best to be, equal and give. I mean, we were brought up in a hierarchical family where my mother and father used to pretty much decide everything for us, and me being a rebel, I had to fight every step of the way, and I was a bad daughter who didn't listen to them and did whatever I felt like doing. And now in the cities, I see a lot of younger parents are switching to this model of, listening to children and taking their cues and trying their best to switch to a different model of parenting. But still in small towns and in schools, which are old-fashioned, old school type of education systems where people don't, I mean, they do punish still in the schools. And they, I mean, even though legally by law, it is, it's not allowed to, use corporal punishments. I do see day in and day out in the newspapers that children are being punished physically for like hit for their bad behaviors. And it takes, I mean, it's a huge country, lot of no exposure. They don't understand a lot of times what is good for children and what's not, including the parents. Hit their children, physically punish their children. And then when we tell them, they think that, spare the stick, spoil the child kind of thinking still exists. So this is like a very higher level. So I'm hoping that, professionals who are part of the conference will take this message to parents, and, and if parents are also there in the conference, they'll try and understand where this is coming from and why is it. So what, I mean, I'm just again asking you this question from the Indian context.
Yes.
What happens if a parent chooses to punish the child physically?
Well, that's a tough question. It's got, I appreciate that question too, because, even here, we have parenting models that still are very similar to what you're describing. Now in schools, corporal punishment, there was a time when that was here in the States, not when I was growing up, but, not that far off. My parents' generation, that was happening in schools. Paddling, for instance, happened in schools. So we are in, I guess you could say we're in the changes here as well. We're not that far off from those days though. So generationally, you're talking about changing cultural beliefs, and that's difficult, and it takes a long time to do it. So understanding what punishment does. And so what I think about the best way, a psychologist could answer better to what it does internally, emotionally. Forget the physical part. We see on the outside what it does. But what we do know is that when you're talking about behavior and you just lead on punishment, to think that you're going to just punish essentially what you're doing, whether you consciously decide or not, you think you're punishing the behavior out of them.
Yeah.
Getting the behavior out of them, or taking something away enough to where it comes out of them. And what you'll see is what you're really doing. If you, number one, you won't change the behavior long term. You might change it when your eyes are on them. It might take a while. And how often do we, none of us can be watching our children at all times, even to think about in the classroom. So what you're doing is you're teaching them to hide things. You're teaching them fear-based thinking. And fear-based thinking is terrible for development. We know that fear-based thinking leads to anxiety, depression, lots of mental health issues that, we're contributing to, and what we think we're doing to help. You mentioned, would you say, spare the rod, spoil the child? That's a phrase I hear here too in our culture here in West Virginia, in Appalachian culture. Or I've heard this phrase. Actually, I've heard this from a principal in the last 2 years. He used the phrase, well, that's too much carrot and not enough stick. And, that set me a little bit like, ooh, I'm trying not to react to that. On the outside, I'm a little scared for your students, because that's obviously thinking. And again, it's not wrong per se, because it's the way they were raised, and they think that their intentions are good, right? The intentions of doing it from the parent or from the educator, it's good. But they have to understand their role in what they're doing isn't long-term. It's not changing behavior, number one, and it's creating other issues.
Yeah.
Self-esteem is tied greatly to that. Shame. You know, there's this great link between behavior and shame.
Yeah.
And Brene Brown, I'm sure you guys have heard of her. Yeah, me too. And she talks a lot about shame. And shame in one of her recent talks, I believe. I can't remember if it's. I've watched so many of her stuff. Forgive me, I can't remember where I watched it. Might be the one on Netflix.
Was the Netflix one? Yeah.
Yes, I've seen the Netflix one, The Call to Courage, and it might be in that one where she talks about shame in the petri dish. And things that if we put shame in a petri dish, the only thing that treats shame, the only thing that changes it is empathy. Yeah. And you think about, as a parent, as an educator, what does empathy look like? Empathy doesn't look like I will hit you until you do what I want you to do.
Yeah.
Empathy is, I want to help you through this. I want to give you skills and teach you how to change this. Empathy is something that, you know, I often tell my teachers, they'll talk about children who struggle. And one big thing they say is, this child has no empathy. This child has no empathy. Yeah. And I said, you know, it's the hardest thing to teach, but the only way you can teach it is, boy, you have to model it.
Yes. And those children who are not able to understand empathy or show empathy were never shown empathy by anybody else in their lives.
Yes.
So how are they going to learn it?
How do you learn it? Exactly.
Yeah.
Exactly.
In our Indian culture, we also were told, I mean, that's what elders in our families used to tell, that we shouldn't praise the child in front of the child, because the child is going to feel proud about whatever they've achieved, and they probably won't achieve more. So we never praise them in front of them. We only give them like reprimands and give them more and more difficult tasks to achieve, so that the child doesn't feel proud, because pride is seen as a bad thing. Humility is always encouraged, and pride is discouraged in our culture, Indian culture. So what happens is, we don't usually praise children much. As part of, culturally, we are not encouraged to praise children. We always say, okay, that's fine. Yeah, you got the first grade, you are first in class, that's great. Move on, next target, you know. So the child doesn't know. You know, I remember my father, I was like the brightest in the class. I used to be like the first in class. My father would just sign the report card and say, good, next, make sure that your next report card is the same, you know. I wouldn't, for many years, I didn't even know that I was like topping the class, and I'm doing very well academically. And if my grade would drop like 1 point or something, he would call me, and I would get a huge lecture from him saying that, what happened to you? How could you just have this lower grade? And I had skipped a grade because I did so well that I was asked to skip a grade and go to the next grade. And my father didn't even just, you know, praise me or pat me on my back. So that's the cultural scenario that we are in, where we don't praise children. We don't show empathy. If they fail, we don't give them a chance to fail. We would protect them from failures, so that they never fail. We just want to see them successful. So it's quite a hard task for us in India to move to this level of, you know, learning. But anyway, we are on our journey. We're trying to teach our children. We're encouraging parents to follow the path. Yeah, that's one thing. The second thing is coming to a special needs context, because now we are talking also about children with special needs, be it autism, be it ADHD, whatever. How do we work with, because a lot of times the behavior is mixed with the sensory difficulties that they have. What advice do you have for parents, you know, in this context?
That's a great question. And same issues here. How do we focus and meet those? And it goes back to really that slide of understanding between behavior is the surface level of what you see, and beneath that is a need, and beneath that is a feeling, or excuse me, beneath that is a feeling and then a need. So if it's a sensory issue, then you can see really clearly, for instance, in that example, that's the need. And if that need isn't met, you will never change the behavior, because what they're doing in a sensory context, so for instance, if it's a sensory seeking behavior, or sensory seeking need. Until you give them the sensory input neurologically to meet that need, then the behavior isn't going to change, because they're doing the behavior to meet an unmet need neurologically. Same thing if it's a sensory avoiding behavior. If they're acting out to avoid something. So for instance, loud noise. I don't like that, so I'll scream, or I'll run, I'll escape to get away from it. So unless you meet the need to avoid the behavior and give them the skills, and sometimes it isn't just, often with sensory, it has to be some external factor that helps meet it. So whether it's through collaboration with an occupational therapist, which I would always encourage, if you can do that, you should do that. They're experts, they're experts in that. But I also know even here, I'm not sure about there, but here, they're hard to find in education. I always say they're overwhelmed, but if we had financially the money to spend, and sometimes if we really look at how we spend money, I say that's a whole nother topic, but instead of maybe putting so much technology, let's put some more people in the classrooms, and an OT in every school would really change you want to talk about really change behaviorally and understanding. And so, yeah, that goes back to that again. If we don't meet the need, we have to treat the cause and not the symptom. And that's no matter if it's autism, if it's a child who has sensory integration disorder, if a child who has some genetic disorder that's causing it, or just every day, we all have sensory issues. We just learn to manage it, but the kids that can't manage it, it goes deeper and bigger than that. So yeah, great question.
Thank you so much. I think for parents of special needs children, it's like we have like two, I have a son with autism, my elder son has autism. And for me, it's like first teaching, understanding, was that a behavior issue or was that a sensory issue, is one layer. That's like one layer. And then once I know that it's not a sensory issue, then it's a behavior issue, then I address the behavior, separately. And then sometimes it could be both. It could be a mixture of both. The child has gotten used to the behavior because of the sensory problems that the child had. But now the sensory problems are resolved, but the behavior still continues. So the parents have to keep, growing and learning, and then adapt to the child's growing needs. It doesn't, he's 21, he still has autism. So that means I'm still learning how to work with a 21-year-old young man with autism and the challenges that he faces because of, autism that he has. So yeah, that's the another layer of complications that parents of special needs will have. Yeah.
Absolutely.
So one message that you want to give parents of young children, whether they have special needs or not, but I think one message that you want to give our parents as a part of your keynote address.
I think for myself, I'll think about I'm a parent. My son is about a month away from turning 3. So I get to practice. I say this to my audiences a lot. I get to practice and fail at this daily. And just because, it's as you said, it's a constant growing and understanding, just like you are as a professional. If you work outside of the home, I started working at 24 after I graduated with my master's. And if I were still practicing and doing the things at 24 that I am now at 40, in 2004 versus 2020, I probably wouldn't be a very good practitioner. And as a parent, we've got to do the same, right? I became a parent in 2017, and hopefully I'm doing a little better now than I was in 2017. But I have my days. So we just did potty training a few months ago. Boy, I tell you, that put me to my limits. We made it, but holy moly! So, but so I think for me, I think about what would I want to know just for parents if it's my son doesn't have special needs, but I've worked with lots of children and families who have. And I think the thing that I will tell you, maybe the most important thing, it kind of goes along, it does go along with what I was talking about, is knowing that it isn't easy. It's an everyday struggle, but it's a worthy struggle. And your child tomorrow and the tomorrow after that will always be better served by the fact that you're just trying. If you try to think about, what am I doing? Am I meeting their needs? am I changing my behavior and my response to it to try to help build and teach and discipline, and not just rely on the quick and easy thing that's punishment, that their tomorrows will be better because of the struggle I fight today. I don't know if I'm articulating that as well as I mean to, but I guess to say, don't put too much pressure on yourself. You're going to fail. We're going to fail. But trying is you're already, by trying these methods and changing this belief system, you're already making tomorrow easier for yourself and for your child. And if we think about that every day, that worthy struggle, then take some of the pressure off of ourselves to know that the child's going to be okay. We're going to come out on the other end of this. And again, at 2 or 21, it's a worthy struggle, isn't it, every day?
Yes. I think children are watching us, and then if they see us trying and failing and trying again and failing again and trying again, they are going to learn from us that it's okay to fail and keep trying, to get a better person. And also when we go back and tell our children that, sorry, yesterday my behavior was absolutely appalling, I'm very sorry, apologizing to our children, saying sorry to them if we behave badly, and acknowledging that it's okay to behave badly as long as you realize it, that it was a bad behavior, and I'm
try better next time
from it. I think it's a two-way process, isn't it? We expect our children to say sorry, but how often do we say sorry to them?
I love that you said that.
Yeah.
It's so true, and it goes right along with the empathy. I'll tell myself, I'll tell my husband and my teachers that I work with, if you don't find yourself apologizing for your behavior and being willing to admit it, how are you expecting your students to do that?
Yeah.
And you're exactly right. We've been working a lot on emotional literacy here in my house while we've been home for COVID and teaching emotions. And it's amazing. It's amazing that my son at 2 years old can now it goes bigger than labeling emotion, but he loves to play at it. And he'll tell me, like, for instance, just yesterday, he's taking toys away from me, his toys, and he'll say, now you're sad. And he'll tell me, cry. So I said, cry. And then he'll come over and console me and say, it's okay. It's okay. We have to share. And it's amazing that he's practicing through play what's difficult with him. So I told my husband, it's so crazy, but it tells us we're on the right track.
Yeah.
He's getting it. Yeah. And, I heard something one time, a parent say, this is a friend of mine whose son has autism. Mm-hmm. And she said, when I go to parent-teacher conferences where we meet with parents periodically, or parents meet with teachers throughout the school system or throughout the school year, she'll say they want to talk about the academics. And she said, I'm fine with that. I want my child to do well, and I want to see what he's learning. But my biggest question is this: is he kind to other people? Are they kind to him? Yeah. Does he have friends? Does he seem caring? Yeah. And I get emotional about that, because I think, boy, those are the things that long term are going to make you a successful adult.
Yeah, exactly. And also, can he coexist with others? Like,
yes.
In a group home, can they live with each other? Can he understand, few things? Yeah, I think that was my focus. That was my goal. I did not over focus on academics for my son. Just making him get so many degrees is not going to help him if he doesn't get these basics right,
Yep. Yeah. It all comes back to social emotional skills, doesn't it?
Yes. Yeah. Thank you so much, Dr. Amy.
Thank you. This was fun.
To the keynote speaker. It was a wonderful speech. This was my favorite topic. I was just dying to listen to your talk.
Oh, thank you. This was fun. I appreciate the opportunity. I'm sorry that the sun is glaring through me here.
It's bothering us. Don't worry about it. Absolutely. You're fine. It's absolutely fine. Yeah.
Great.
There's so much used to sun. Sun is all over the place for us. So
yes. I hope you have a great conference, and I appreciate the opportunity. And if I can be of any assistance to anyone that hears this, my email's there, and our website and our Facebook. So I appreciate you, and thank you for all the work you're doing.
Thank you so much. Thank you once again. Bye.